Since its unprovoked full-scale invasion of Ukraine in February of 2022, Russia's deliberately targeted civilian infrastructure with missile, drone, and artillery attacks. The World Health Organization has done surveillance, and their teams have documented over 1,500 attacks on health facilities themselves, 116 deaths of health workers, and 244 injuries. The attacks have affected the access to health care for patients. They've damaged the healthcare facilities. They've destroyed the transport for health, such as ambulances. They've destroyed warehouses and medical supplies. About 14% of the healthcare personnel have also emigrated outside of the country, which of course has caused a problem in the provision of healthcare for those people who have been injured or those that are still living in Ukraine. Luckily, the government of Ukraine has ensured sustainable and stable healthcare financing, mainly thanks to the steady support from our international partners like the United States. Now, when it comes to adults, the number of strokes and myocardial infarctions has increased, indicating a higher burden of these particular cardiovascular diseases. Burden of stroke in 2022 increased by 10%. Myocardial infarctions increased by 12% overall. But the regions that were most affected by the war, where there was a large migration of people out of the region and no facilities left in the region to take care of patients, they had a big drop in hospital admissions, while other regions, such as in central and western Ukraine, have had a marked increase, where there was a 20 to 40% increase of myocardial infarction events since 2021. Access to food and medical products has been restricted, sometimes due to curfews, air raid sirens, lack of deliveries because of logistical problems. And we know that those are the kinds of things that affect people's general health. So the burden of both communicable and non-communicable diseases has greatly increased since the war started. Global health has been impacted by the war that Russia started in Ukraine. And let's be clear that there is only one country that's at fault here. Russia's war on Ukraine has sparked a global health crisis that is caused by the death, suffering, and displacement of people in Ukraine, to the global food and fuel insecurity, diminished donor funds to support other health issues. There's also been an energy crisis, a food crisis, a climate crisis, and migration. The escalation of the offensive actions from Ukraine, from the Russian Federation, is also directed towards Western governments and Western populations. There's been a significant increase in healthcare cyber targeting worldwide. There's also been a parallel war of online disinformation directed towards two essential health security issues. One of that is disinformation about vaccinations, creating doubt on whether vaccinations are necessary and whether they are successful and useful. And the second one is the supposed presence of illegal biological laboratories in Ukraine producing some sort of imaginary biological weapons for the United States. The largest donors to global health initiatives in Europe and in the United States have sent millions of dollars in aid to Ukraine, and this has been very beneficial and has been very helpful. However, what it's also done is raise difficult questions in many capitals on whether they can continue to provide the same level of funding, especially to other global health initiatives. Therefore, the support of Ukraine to be able to get to victory sooner rather than later will really have a positive impact on health security globally, as well as within Ukraine itself. The blockade and the loss of about 20% of planting fields because the territory is either occupied temporarily or along the front lines of hostilities have surged world market prices and risk not only to undermine Ukraine's agriculture and food sector and economy, but also to starve millions of people globally. Ukraine's grain exports were equivalent to feeding more than 400 million people. In 2019 and 2021, Ukraine accounted for nearly 10% of global wheat exports, 15% of corn exports, 15% of barley exports, and nearly 50% of the sunflower oil exports. So Ukraine not only has been able to regain capacity to export its grain and other products for sale in other countries, but has also been able to provide humanitarian aid to those countries who have been most affected by the weaponization of food that the Russian Federation has caused since it attacked Ukraine. Health security is part of overall security. And just as we invest into our military, we need to invest into our health system.